I am, very concerned myself. I'm submitting a comment. I would highly recommend you do the same. Sup guys, quick public service announcement for those who utilize telemedicine for TRT, testosterone replacement, among other medications. There is a proposed rule by the DEA that, if left unchanged, could significantly alter the course of telemedicine and access to medications, ease of getting your prescriptions, administrative burden for doctors, insurmountable obstacles for telemedicine platforms. Like, the impact and gravity of this going through as is could be quite detrimental to the industry as a whole, and it is worth touching on and submitting your opinion before the deadline, in addition to sharing with those around you who would also be impacted by this to do the same. So, quick overview, as quick as I can. Basically, this is for telemedicine prescribing of controlled substances when the practitioner and the patient have not had a prior in-person medical evaluation, and a proposed rule. They proposed this March 1st, and comments are due March 31st at noon EST, 9 a.m. PST. So, summary, what is happening? With the expiration of the C-19, who knows if we can say it on YouTube without getting algorithm suppressed, public health emergency set to expire on May 11th, the DEA has proposed new rules to update the Ryan Hate Act, which could negatively impact patients and the telemedicine providers prescribing of non-narcotic medications in Schedules 3, 4, and 5. These rules would require in-person evaluations, stricter record keeping, increased coordination between physicians, and more frequent, smaller refills. This would create additional burdens for both patients and doctors, leading to limited access to treatment, increased costs, and potentially increased risk of harm to patients. Now, notably, this rule is meant to be harm reducing. It is supposed to be, making it more difficult to get access to certain narcotics that could be haphazardly prescribed. However, the unfortunate byproduct of this would be what falls into Schedule 3 that kind of perhaps doesn't make a ton of sense to be in there: testosterone, androgens. This is something that, and perhaps other medications that individuals rely on. These non-narcotic medications like testosterone that people are on for life and heavily reliant on do not belong in this rule change, is the opinion of many who are very, have a lot of scrutiny of these proposed changes, and I believe could be quite detrimental as well. So doctors would face challenges like increased administrative tasks, technology requirements, limited prescription options, and reduced flexibility. Patients would be affected by the need for travel time for more in-person visits, more frequent refill requests, restricted medication options, and higher costs. These rules have not yet taken effect, and there's still time to petition the DEA to reconsider. Public comments can influence the outcome, so sharing your thoughts on the matter is crucial. Alternative solutions include allowing a 90 to 180-day supply of medication without extra requirements, easing of restrictions on examining physicians related to in-person visits, and offering more flexibility in communication between doctors and patients. If you want to see more information and a complete dissection of this, I highly recommend going to excelmail.com. Nelson Virgil, the founder, put up a very, very detailed breakdown of all of this, and is partially where I got this executive summary from. So definitely check it out for further detail. Now, in simple words, summarized, just going to get a physical with a local doctor will no longer be sufficient for a telemedicine clinic to treat you. You will need to, 1, get an exam by a practitioner with a state DEA license, and not all of them have this. Your telemedicine doctor will need to be present virtually during this exam via two-way video or voice chat. Very burdensome. The practitioner you visit for your physical will have to keep medical records of your exact treatment from your telemedicine provider. So when your treatment is changed, etc., the practitioner will need updated records from your telemedicine provider. So basically, you need to find a local practitioner who is completely on board with the exact treatment protocol that you are being given from the telemedicine practitioner that they are providing. They need to have enough time and energy on their hands to deal with the complexities of the being present virtually, having the telemedicine doctor there simultaneously, like over a, FaceTime or whatever with your in-person doctor. And 3, keeping medical records of everything. when your protocols are changing and whatnot, like if you're on, starting TRT and you are trying to dial in your dose, for example, the practitioner you are seeing for your physical will need to also keep all of the updated medical records every time your protocol changes as you get dialed in. And the overall culmination of all of these factors is a nearly insurmountable barrier to care for most people. Like so many additional steps, administrative burden, pretty difficult hurdles to clear without it just being a gigantic, like how many people are going to go to UGL labs after this and just end up on underground testosterone brewed in a bathtub because of this stuff? Potentially quite a few people. After a single 30-day supply from a telemedicine provider, you will then have to see the provider in person or just do the whole local provider while on a call simultaneously with the telemedicine provider thing that I mentioned. The telemedicine provider can't just keep prescribing 30-day supplies via a FaceTime, Zoom, Skype, whatever. After the first interaction, you can not just keep getting refills. You would need to go through this whole shebang. So what can you do exactly? You can give your opinion. I will post a link to where you can put your comment. Example verbiage that obviously say something that is tailored to your own individual situation and how you feel. You definitely personalize this. Something that I came up with and was based on some of the other responses that seemed very, very, kind of summarize things nicely. I am a patient currently benefiting from telemedicine care, which I actually am as well. This treatment has made a dramatic effect in improving my quality of life and vitality. The proposed updated DEA rules on the Ryan Hate Act will create a new burden for me of travel time to see my doctor and to manage my more limited and frequent medication refills. This time requirement will decrease the time I am able to perform my job and family duties. I am happy with my current care and see no benefit in imposing these new rules on taxpayers like me. So again, putting testosterone into this, lumping it in indirectly, although that may have not been the actual intention whatsoever, it is part of this nonetheless, and I believe should be excluded. So proposed solutions, DEA should allow a minimum 90-day or upwards of 180-day supply of non-narcotic Schedule 3, 4, and 5 medications without additional requirements is one proposed solution. Physicians who performed physical exams, examining physicians should not be required to have a DEA registration. A valid state license should be sufficient to complete the physical examination for the telemedicine physician. Examining physicians should not be required to be present during the prescribing physician's patient encounter. Examining physicians should not be expected to maintain records for prescriptions they do not dispense. The patient should always have the option to opt in or opt out of the video communication option due to comfortability, location, and or knowledge and capability of using video communication technology. The examining and prescribing physicians should not be required to do a live handoff. So obviously this is going to vary depending on if the telemedicine platform you are utilizing has a physical in-person location, is over some sort of video platform for communication, or if you're getting a physical with a local physician and they have to communicate directly with the prescribing physician over telemedicine. They need to be on the same call at the same time while you are physically present, having somebody on call at the same time. Like, it can get burdensome, complicated, and present significant obstacles that will be fairly problematic to say the least. So I would recommend submitting your opinion. It can be, I highly recommend you make it tailored and unique to your own personal situation. This was just kind of a high level breakdown, and a lot of it was extrapolated and pulled out from the Excel mail breakdown that I mentioned by Nelson. Highly recommend you check it out, by the way, to learn more. And again, I am not the kind of representation of an accurate interpretation of this. To be clear, it seems like no one really knows for sure how problematic and strict this will actually be if it goes through as is and what's going to happen. All we know is that it does lump a lot of things into this proposal that perhaps were not intended to be and could otherwise make things quite problematic for patients and lead to harm, complications, increased costs, and making it just inaccessible or completely inefficient for many, unfortunately. So, I am, very concerned myself I'm submitting a comment. I would highly recommend you do the same if you're concerned as well and have a strong opinion about it. And again, like, it's kind of uncharted waters. No one knows for sure like what's going to happen if this thing goes through as is. And if it goes through, I believe the potential alterations to it that do not include, testosterone, for example, would be a huge improvement, obviously, for people who are on testosterone replacement therapy or other contextually relevant situations. This is something that it cannot just be a blanket thing that is occurring without consideration for some of the individuals that may be negatively affected, and it does not make as much logical sense to just lump it all together. And I believe it needs to be parsed out a bit more, dissected further, and updated accordingly to be mindful of some of these individuals that will be negatively affected unnecessarily. So check out the link. Drop a comment, share with your friends and family, anybody who would otherwise be affected by this or has any concern. It would be, I would highly recommend it. Comments are due March 31st. I'm kind of late to the party on this too, unfortunately, but I got my comment in. Hopefully you guys can do the same. And let's hope this thing is updated accordingly. So I will talk to you guys soon.